Controlling glucose levels is an important regulatory function of the body. When this is not functioning properly, one can get diabetes mellitus 2, and this can lead to other health complications if it's left untreated. There are different treatments available to cope with this disease, and today we'll be taking a closer look at these topics.
Glucose regulation is governed by two hormones, insulin and glucagon. Glucose is used by our cells as fuel for performing physiological functions. It enters cells via protein transporters with the help of a hormone called insulin. Insulin is a protein hormone made in the pancreas and secreted by pancreatic beta cells. It is used to regulate glucose throughout the body by allowing plasma glucose to enter into our body cells. Glucagon is a hormone that does the opposite of insulin. It promotes the release of glucose into the bloodstream and maintains blood glucose levels by ensuring that glucose levels remain within normal range, which is approximately 4 to 6 millimoles. Alterations in blood glucose levels can go either too high or too low. When glucose levels are too low, this is called hypoglycemia and is defined by a blood glucose level of less than 4 millimoles. When glucose becomes too high in our blood, it's called hyperglycemia and occurs at levels greater than 7 millimoles. When blood sugar goes low, pictured here in red, the pancreas responds by secreting glucagon, which stimulates glycogen to be broken down into glucose, which is then dumped into the blood to raise the blood sugar. When blood sugar is too high, pictured here in yellow, the pancreas responds by releasing insulin, which does two things: stimulates glucose uptake from the blood, and stimulates glycogen formation at the liver, which both remove glucose from the plasma, therefore lowering blood glucose. In diabetes type 2, two things go wrong. One, peripheral cells become resistant to insulin, meaning the cells do not respond appropriately to the action of insulin to take up glucose. And two, hepatic glucose output increases. This is when the liver lacks stimulation from insulin to make glycogen, so it will keep producing glucose.
The majority of diabetes mellitus cases are type 2. That's about 90 to 95%, and it affects people all around the world. Like stated on the previous slide, with type 2 diabetes, there's a lack of sensitivity of insulin receptors at the target cell, as well as a deficiency in insulin secretion, even though the pancreas is still able to produce insulin. This just means that there's a smaller quantity of insulin produced, and what is produced is less effective. Some of the signs and symptoms of type 2 diabetes are blurred vision, fatigue, excessive urine, and increased hunger and thirst, to name a few. These usually have a gradual onset and will generally affect people over 35 who are overweight and smoke. If left untreated, diabetes type 2 can result in many chronic conditions due to the long-term damage it has on your arteries. And we see things like heart disease and stroke, particularly dysrhythmias and heart failure, kidney disease, blindness. In fact, to quote page 215 of Jarvis, people with diabetes are 3 times more likely to be hospitalized with cardiovascular disease, 12 times more likely to be hospitalized with end-stage renal disease, and over 20 times more likely to be hospitalized for a non-traumatic lower limb amputation compared to the general population. So to quote Jarvis again on page 251, there's a stat that says approximately 1 million Canadians currently have diabetes but have not yet been diagnosed. This means that it's even more important for individuals over 40 to be screened for diabetes every 3 years. And this is done by interview questions to assess health history, physical assessments to look for the manifestations, signs and symptoms, and also lab works to confirm a diagnosis or to determine if someone is pre-diabetic.
Individuals living with type 2 diabetes can live long, healthy lives when they combine exercise, diet modification, and drug therapy to control their blood glucose and reduce their risk for serious complications. The first-line treatment is lifestyle modification, which includes increasing physical activity and modifying diet to help regulate blood glucose levels. When this treatment option fails, pharmacotherapy is recommended as a second-line treatment using anti-hyperglycemic drugs. One option is canagliflozin, or brand name Invokana. This is a sodium glucose cotransporter 2 inhibitor, and its desired effect is to regulate blood glucose levels and decrease the risk of complications in patients with type 2 diabetes. Approved by Health Canada in 2014, Invokana allows for more glucose to be excreted into the urine. It is indicated for the treatment of diabetes mellitus type 2 in addition to exercise and diet. Its mechanism of action is that it promotes renal excretion of glucose at the proximal tubule by inhibiting the reabsorption of glucose. Its pharmacokinetics include the onset 24 hours after the initial dose. The half-life of a typical 300 milligram dose is 13.1 hours. This drug peaks at 1 to 2 hours and is excreted in the feces and urine. Side effects include female genital mycotic infections, urinary tract infections, and nasopharyngitis. Some adverse effects could be hypotension, renal impairment, hyperkalemia, and hypoglycemia. Contraindications for this drug are hypersensitivity, impaired renal function with an estimated GFR of less than 30 milliliters per minute per 1.73 meters squared, and patients on dialysis. Nursing implications include monitoring blood glucose, fluid volume status, and renal function prior to and after drug administration. In conclusion, glucose regulation is an important part of our body's normal functioning, and this process is seriously impaired in a person who lives with diabetes mellitus type 2. The manifestations of DM2 reduce a person's quality of life and can cause severe, life-threatening complications such as heart disease and stroke when left untreated. Treatment options exist, including lifestyle modification and pharmacotherapy. A person with diabetes mellitus type 2 who is able to control their blood glucose levels can live a long, healthy life.